are a simple way to help minimize coronavirus transmission and save lives. According to the Centers for Disease Control and Prevention, the spread of COVID-19 in public places has been reduced after wearing face masks. Many kinds of face masks are currently available in the market. However, some masks are more effective than others. So here are some types of face masks that are commonly used during this pandemic. Cloth face mask fits against the face, using either ear loops or ties around the head. Multiple layers of fabric create a barrier between your nose and mouth and the outside, helping contain any respiratory droplets that you may breathe out. The thicker the mask, the greater the barrier. Surgical masks are disposable covers that are usually worn by medical professionals as personal protective equipment during surgeries or other procedures. They often made a combination of paper and plastics and are commonly light blue in color. Surgical masks are designed to protect against large respiratory droplets but don't protect against smaller droplets. They are effective for helping protect others around you if you are a carrier of the virus. While these masks are ideal for one-time usage only, they also present a few challenges, namely that they can be washed and reused like cloth masks. N95 masks provide a higher degree of protection than a surgical mask or a cloth mask because they can filter out both large and small particles when the wearer breathes. They are called N95 masks because they are designed to block 95% of particles or liquids that may come in contact with your face. However, these masks are not for general public use and should be reserved for healthcare workers and other medical first responders. Healthcare providers are fit tested for these masks, and like surgical masks, they are intended to be single-use only. These masks may make it easier to breathe out, but as the wearer is doing so, they are also exhaling their germs into the air around them. Increasingly, more medical facilities around the country have banned the use of masks with bulbs. They do a good job protecting the wearer, but because of one-way bulbs, they don't offer much protection to the people around the wearer. If the wearer is contagious, either knowingly or unknowingly, they could still be spreading the virus to others around them. Since the main reason to wear a mask is to protect others, a simpler mask with a filter may be a better choice. So here are some fun facts about face masks. Fun fact number 1. The surgical mask was first used in the operating rooms of Germany and the USA in the 1920s. Especially in endoscopic procedures or small surgery, the mask was renounced for a long time. Fun fact number 2. Some people have suggested that carbon dioxide from exhaling gets trapped under the cloth and can make it sick. This isn't true. Properly fitted masks cover your nose and mouth. This makes the accumulation of carbon dioxide seem possible. Here's fun fact number 3. The key to wearing a mask is to make sure it fully covers your nose and mouth. It should also be low enough to go over your chin so that air cannot easily escape. Fun fact number 4. COVID-19 is transmitted from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly being held into the lungs. Masks provide a simple barrier to help prevent these respiratory droplets from spreading in the air. And for fun fact number 5, children need to wear face masks. WHO recommends that children over age 2 should wear masks in community settings where physical distancing is not possible.
Check the mask for filtration, breathability, and fit. Find the one that fits closely over your nose, cheeks, and chin. Instead of being filtered through the cloth, air penetrates through the edges of the mask when edges of the mask are not close to the face and pass, such as when talking. Masks with vents or exhalation valves are not recommended because they allow the mask to escape unfiltered air. Examples of protective equipment are N95 respirators and surgical masks. The CDC does not recommend the general public by wearing N95 respirators. Those are essential supplies that must continue to be reserved for healthcare staff and other medical first responders.
When donning your face mask, you'll first perform hand hygiene. When you're ready to don your mask, you will pick it up and place it on your face and loop it around each ear. Then you will gently pat it around your face to form into the bridge of your nose and pull it under your chin. Remember not to touch the fabric part of the mask. Wearing a face mask is one of the most effective ways to prevent the spread of the virus, in line with important measures such as practicing social distancing and washing your hands frequently with the use of soap and water. It is extremely important to maintain safety measures until vaccine is ready. Be a hero.
Mask up, protect, and respect.